Hello, and hello to everybody who's live streaming out there. Thanks you. No, I can't tell you where the app is. Someone will say where the app is later. Ask at the desk, but turn on to the app. Hi, everybody. My name is Ann Mosley. I've met everybody before. This is our last conversation for our first day of the Aspen Forum on Children and Families, and this is a very, very special conversation for a host of reasons. One, we have two of probably the most influential philanthropic leaders here with us for this discussion. You have their full bios, but Carol Larson, who has been the CEO and president of the Packard Foundation starting in 2004, and Be Still My Heart, and many others around the country and around the globe, has announced that she's stepping down. And she came to the Packard Foundation in 1995 as a director of programs. And while I don't know all about you, Carol, but every experience I've ever seen or been, your love of children and families, of the environment, your way of leading in philanthropy, you have been this sort of strong, generous, thoughtful force of bringing people together. Never needed to be the loudest person in the room, but usually you were one of the most influential. And so I just, on behalf of the Aspen Institute, we've been privileged to work with both the Robert Wood Johnson Foundation and the Packard Foundation. We will enjoy celebrating and still working hard all the way through until December 31st with you. I want to say thank you. I'm also delighted to introduce Dr. Rich Besser. Many of you know him as the president and CEO of the Robert Wood Johnson Foundation. He has also been the chief health and medical editor for ABC News, director of the CDC, and also my favorite is still an active pediatrician doctor out there. So just also bringing that piece into the conversation. This conversation is really about the intersection as we think about work and poverty, the other side, and health, and family and children. A couple things, I don't know how many of you had a chance to see in the New York Times. There was a really powerful piece in the magazine this Sunday by Matthew Desmond that looked at the impact of the minimum wage on health impacts. And this is something where I've sort of thought a lot about the minimum wage, but he really articulated that the incredible health wins if you have a minimum wage that is $16 an hour, and the incredible reductions it brings into sort of unhealthy habits, be it smoking or stress, to then translating it into how to have regular doctor appointments, better parenting skills, and so forth. And there was a body of research that was by the New York Department of Public Health and Mental Hygiene that cited between 2008 and 2012 that if the minimum wage had in fact been $15 and not $7, that they would have been able to prevent up to 5,500 premature deaths. And so, a lot of times when we think about the incredible work of the Robert Wood Johnson Foundation, bringing a culture of health, and we think about social determinants of health, we think about children and families, it's just a very powerful time and a really important conversation. So, and the last thing I'll just say on the two-generation front, as we all know, there's probably no stronger indicator to a child's health and well-being and mental health than that of their parents. And if you don't believe me, Child Trends just came out with even more strong reinforcing data on that. But so this just goes to show why health and the intersection to work and security is so important. So I'm going to kick off, and I'll go first to Carol and then to Rich. Just share a little bit about what are your top priority in 2019 at your foundations, and maybe what data or lessons learned helped inform that.
Great, good. Well, it's wonderful to be here. And I have to start with saying I was honored to be at the one in 2017 that you did. And we had just had an election. Oh my gosh. And we were all so concerned about that. And with good reason for a lot of issues that involve children and families. But congratulations, Ann and Aspen, on continuing this Ascend effort. The deep-rootedness of the network and of the fellows, of this kind of a convening. And also to say that big on our mind at Packard is children, families, and communities. We're a 55-year-old family foundation. And I've been working for them for 30 years, actually. And I'll say a little bit more about that in a minute. And I've been president for 15. But we knew even when times were looking bad that we were going to hang in there, and we doubled our grant making. We did a lot more in kind of rapid response grant making after the elections. And right now, we're looking at an opportunity, because there has been so much change in state level work, which you were ahead of your time in sort of promoting innovation at the state level, where we are located in California. And there we have an opportunity like we haven't seen in a really long time for real innovation at the state level. There's so many people in the audience that I've known for 30 years who see more chance and more attention to do something creative and innovative. So for us, it's to take advantage of these windows of opportunity in 2019 on children's issues in California. Looking nationally, though, we do want to be sober about that. That one of the things with all of our deep, long decades of experience on promoting access to children's health insurance is the trauma of watching how CHIP was so hard to be authorized. How, oh, can you hear? That the children's health insurance, children's health insurance program was, that it took, you know, it was in jeopardy as long as it was, and how it was caught up in the polarization overall in the country. People may not be as polarized about caring about children and families, but it really did damage. And you know, we support work through Georgetown and these finish line states across the country. And despite all the progress that we've seen on access to health insurance, there's actually a slight dip in some locations because of this. So I'll say a little bit more toward the end about kind of my reflections around children's advocacy for all of these years. But I did also want to say that for 2019, something that's really healthy in philanthropy and is healthy for our country is being criticized and pushed on to what extent we share the privilege and the power that we have, and to what extent we listen. And I did get a chance to hear in the overflow room Lynn Johnson talk about listen better and listen deeper. At the foundation, we talk about listening with a willingness to change. And I think that this, we can talk more about it through the hour, but I think lots of ways that we're all trying to do a better job of that. So great hope in California, great being sober about the polarization of the country, how it's going to affect our kids, and that for philanthropy, we are really trying to improve the way we do our work.
Thank you so much, Carol. And thank you for remembering back to 2017. Yeah. That was a time. That was a moment. Rich.
Well, thanks very much. And I want to first start and thank you for this convening and for having me here. We really value the partnership we have with Aspen, the work we do with Ascend. I wish I'd been able to be here for the day and for tomorrow, but I'm glad I have a little time for conversation. You know, when I think about what our priorities are, about 6 years ago at Aspen, we launched this idea of a culture of health. And it was a recognition that while having access to healthcare is absolutely critical for health, if that's all you have, you're not going to have the conditions that allow people to lead healthy lives. That health is something that takes place where we live and work, where our kids learn and where they play. And if we're not creating conditions in those settings that allow people to make healthy choices, you can have a great health care system, but we're not going to be a healthy nation. And so that remains our vision. That is what we're working with others to try and build. When I think about 2019, what we're trying to do, it really comes down to health equity. We are doubling, tripling, quadrupling down on the importance of health equity in all that we do. And when we talk about health equity, what we're talking about is the opportunity that people have or don't have for health and well-being. And we believe that everyone in America should have a fair and just opportunity for that. You asked about what data informs our priorities. And I think that our priorities are informed by data. They're also informed by listening and by story and experience. As you mentioned, I'm fortunate enough that I've been able to be a part-time pediatrician throughout my career. And it's always been at federally qualified health centers. And in those settings is where I pick up the stories and I see the lived experience of people who know what it takes to raise healthy children. They know what they need, and they know that they're in a system that is not allowing them to make those healthy choices. So in Atlanta, I worked in a clinic, and I remember this 4-year-old boy, and he just wasn't gaining weight. And I examined him. I couldn't find anything wrong. We ran tests on him. And it wasn't until the registrar in that clinic developed a close enough relationship with his mother that she opened up to him and said, opened up to us, or to the registrar, and said, he's hungry. We don't have food every day. And he was an undocumented immigrant, and he didn't have access to the safety net programs. And so we were able to connect them to food banks. But in America, in this century, that's the solution for this little boy should be unacceptable. In New York, the clinic I worked in saw mainly foster care kids. And I remember this grandmother who traveled from Staten Island to Harlem to see us in the clinic. And talking to her about, go through the regular questions that you do as a pediatrician. I said, how much exercise do the kids get? CDC recommends an hour a day, 5 days a week, for fitness. And she said, well, they don't get much exercise. On the weekend, I try and take them to the park. I said, well, the CDC knows that you need more than that. And she said, yeah, I know that, but it's not safe in our neighborhood for the kids to go out and play. So here's someone who knows what it takes but isn't able to do that. And now I work in a clinic in Trenton, and I saw this mom of a 4-year-old kid, and he has severe developmental disabilities. And she's been waiting almost 2 years to get him the services that he needs. And I know that if that child gets those services, he'll be able to achieve his potential. So those are the stories that inform it. And then there's the data that informs it. Each year we put out county health rankings that look at the health in every county in America. And last year, we broke down the data not just by place, but also by race. And what we saw is it didn't matter if you were a highly performing county or a low performing county. Black residents did worse than white residents. Across America, the infant mortality rate for children born to black women is twice that of the infant mortality rate for babies born to white women. And you'd say, well, maybe it's a reflection of educational levels. Well, the Brookings Institute did a really nice study that broke it down by educational attainment. A baby born to a black woman with an advanced degree is more likely to die in the first year of life than a baby born to a white woman with less than an 8th grade education. I mean, absolutely unacceptable. And then once a child is born, we funded research that Raj Chetty and his colleagues have done to look at mobility. Yeah. And a white boy born to a low-income family is 4 times more likely to end up as a high-income individual than a black child born in a low-income family. And if you're born into a high-income family, a white boy born into that setting is twice as likely to stay high-income. These things inform what we do and tell us that if we really want to address health in America, we have to address these factors. And that's what we're trying to do in our work.
Thank you so much, Rich. Let's stick with the equity theme, and then I want to come back to the theme of sort of voice and community. And I'm sort of wondering, Carol, from Packard, different foundations have different ways of framing it. When I had the privilege of serving with my former leader, Sterling Spearin, who's here, at the Kellogg Foundation, there was a big focus on racial equity. It was how we looked at it at the Kellogg Foundation. How do you think about equity, justice? What does that conversation and then the work look like for the Packard Foundation?
Well, I think it starts with our own organization and our own selves, of really looking at the combination of diversity, equity, and inclusion, looking at understanding the privilege and the lenses that we carry with us. And then really picking up some, sorry, I should move this darn thing. Yeah. Move this. I'll hold it. How about that? And then really practicing that listening that we're talking about. As a foundation, we have always said that we absolutely believe that access to quality early care and quality health insurance and health services is a right and aspiration for every child in the country, every child. And in all of our work, we have tried to look at systems that have that universal approach. But at the same time, our listening in community, our looking at the data that Rich was just talking about, is we can't get anywhere close to that if we don't disaggregate data. Yeah. And if we don't go into community and different communities and give up some power and actually hear how the context changes in which people experience the systems and policies. So we still talk about a right of every child to health insurance and childcare, but we know to be effective at reaching that goal, you really have to be looking at the kinds of breakdowns that you're talking about, Rich. But it's a much more comprehensive process than just data, and I agree, data and stories. It's also about, and I heard some of that, certainly with the parents panel and others, it's about who we are as people who work in this field and changing a mindset about that.
Yeah, no, thank you. That's great, Carol. And Rich, as you sort of answer that and adding on, I just would like to acknowledge that when I think about the health equity work that the Robert Wood Johnson Foundation, it's almost, you've created a field in that world in itself. And so just health equity and equity for you and the foundation, how are you going deeper on that?
Yeah, when I arrived at the foundation, we had a health equity team that was very effective, very focused on programming around health equity. And as we thought about health equity and what it's going to take to create a more equitable nation, what we recognized is that we can't have a team on health equity. All of our work has to be health equity. And so a little over a year ago, we dissolved our health equity team, and we put the responsibility for health equity in each of our programming areas. So our work in healthy children, healthy communities, our leadership programs, our transforming health systems, all have goals that relate to health equity and are all seeing what they do as critically important. Your comment, Carol, about disaggregating data, we want that across all of our work, not just the folks who were thinking directly about health equity. When we talk about health equity, we try and broaden the definition to include equity related to gender, to income, to geography, to disability, to age, and then the one that's hardest to talk about, the one related to racism and discrimination. We include all of that in there, and we try and words really matter, and even the phrase health equity can shut down conversation in many settings. Well, we tend to talk about it as opportunity, and everyone in America having a fair and just opportunity for health, tying it to fundamentally American values, the value that we were all created equal, we pledge allegiance to with liberty and justice for all, the American dream. These are things we haven't lived up to as a society, but they're things, they are ways of framing that can cut across the political divide. And one of the things that we're trying to do as a foundation is say, can we shift the conversation? Can we find some common ground? Can we make progress, even in an environment like now, where the nation is so divided? And some of the ways of framing, some of the work around children, especially early childhood and education, there is some common ground. There is some opportunity to, I think, make some progress even today.
That's great. Well, I want to take one other chance to probe a little bit more deeply, again, as we've been talking about, and you both have stated, about the power of really going close to community and really connecting with families and diverse communities. But philanthropy isn't always known for being so accessible or so easy to reach. Not your foundations. But how do you build into sort of how have you all gone about sort of building in the culture of the foundation, or different strategies you might have from your work, or how also others in communities can connect with you in a way if it's in service of trying to open up that conversation and get, as the wonderful Brian Stevenson says, just get more proximate. Why don't we start with you, Rich, and then Carol?
Well, I mean, on a personal level, I'm thankful that I can feel that I'm more proximal through my work in the clinic. At the foundation level, it really is a challenge as a national philanthropy to truly listen. And some of it we do through partnerships. We have a partnership with YUSA, which is in 20,000 communities, 10,000 communities, 22 million people. We have a new partnership that was announced a couple weeks ago with the NAACP, which is so connected in communities of color. We have a big strategic partnership with 4-H. And through partnerships, it's one way for us it's still a step removed, but to at least be demonstrating the importance of listening. We've done listening tours where we fund work to go out to communities around the nation and ask questions about the work we're doing. 3 years ago, we did one around culture of health, and what we heard is that communities want to be given the opportunity to define the problems that they have and raise up the solutions that they know will address those problems, and not have it be coming from us in Princeton, New Jersey. We're in the midst now of doing a series of focus groups around the nation that are interviewing a wide range of families from around the country around the question of what do families need to raise healthy children? What is it they need? And again, I'm not sitting at the table, but we're getting information from a diverse spectrum of families that hopefully will inform our work. And we're constantly asking the question, how do we get a more diverse group of people to the table, whether it's in our boardroom, whether it's in the work we do within the building, or what we do out in the field.
Thank you, Rich.
Yeah. I'll pick up on that last point, because I think for all of us here, no matter whether we're in a government organization, nonprofit, for-profit organization, it begins also with the culture of your own place and the values of your own organization and of your board. And I've been fortunate to have a board that's half family members of the Packard family and half general trustees. But a core value is about listening, and a core value that I get pressed on at every single board meeting, which really matters, is, how do you know this? Who have you talked to? Why haven't you talked to? It begins with a board, with a culture, with a set of values. Then there really are some ways to seed some power. And we also are a global foundation, and we not only are global in reproductive health and others, but also on climate and on ocean work. And so we can't be at every table, but there are really ways that you can get such valuable insight and also seed power in how you set up your strategy. So I like to hold up our work that Mira Mani and Katie Beckman here are handling for us at Packard in 3 communities in California. And we can't be in every community, but it's been so useful for me and for our board members and for our staff to actually go and sit, for example, in Fresno. That's where you really get to hear some of the disaggregated data and the impact about which neighborhoods and which zip codes, but also where you can also hear some hope about that there are commonalities, that when you actually look at a community level, people do come together. And when you give power to that community, money and ability to shape the strategy and to give the feedback and to change when you hear it, really, really good things happen. But I do want to say one other thing about listening, because one of the great, check out something called Fund for Shared Insight. So this is a big collaborative of foundations across the country, but it's doing such creative work around helping every organization, including policy advocacy organizations. How do you check in with your beneficiaries? How do you get feedback? And so we're doing some grants out of our children's program on that. Oh, and I can't help it. I have to say one more thing about build it into your broader strategy. So we have a 5-foundation collaborative called Pediatrics Supporting Parents, and really about how do you work with well child visits and well health care to really develop the social emotional connections and encourage the focus on family. But one of the key grantees in there is Family Voices. I don't know that too often in the past too many big foundations have not just worked with the Urban Institute and AEI and Aspen, but actually with organizations getting Family Voices. So those are just some thoughts about ways we're trying to listen, even though recognizing we certainly can't be at every table.
That's awesome. I'm going to have a bumper sticker, Pediatrics Supporting Parents. That is awesome. Great tagline. We're going to go to questions and from the audience in a second and just sort of bring everybody in. But I just can't help myself. One question for both Carol and Rich, sort of different for both of you. But Carol, you've been sort of kind of a pillar of philanthropy, and philanthropy being the love of humankind. And I think you actually really embrace that. You've experienced a lot with a lot of different foundations, and I'm kind of wondering, because there'll be lots of questions here, but if there's anything, just a reflection about as we think about going forward, or even sort of for the field of philanthropy that you'd like to share. And then, Rich, to give you a moment, you've come in from leading the CDC, ABC News, that's a different set of expertise to also, bring to philanthropy. At this point in time in the world, I think philanthropy is sometimes that special sauce that can change a conversation or bring people together. But just, any kind of insights or thoughts you might share for those of us that you have folks here that from around the country, but are really kind of coming together across policy, practice, family work, community work, thinking about kind of the North Star of health and well-being for kids and families. So.
Do I get more chance at the end to do other wrap-up comments too?
Sure,
Good,
absolutely.
Okay. So I won't say everything I want to say right now. But I did want to say about the role of philanthropy and about partners. So I graduated from law school 40 years ago. I just went to my 40th law school reunion last year. And 40 years ago, that summer, 2018, I worked with Children's Defense Fund and DuPont Circle. Marian Wright Edelman was my heroine, and I was going to have a life in children's advocacy. Then I went to practice law for 10 years. I did some nonprofit work and then decided life was too short and I was going to go back to children's interests. And lo and behold, cut my salary into a third, met Dave Packard. He offered me this little job as kind of a program officer at the Packard Foundation. Never looked back. I think to be in positions of resource or power, like many of you are in the room with government, and in our case in philanthropy, to never stop understanding that and to realize that your privilege and your duty is not just about what you do, but also about how you do your work. And that how you do your work really matters in terms of understanding the issues we've been talking about. So there's more to look ahead to a great journey, but it does take a long time, and you see these windows opening and closing at different times. Mm-hmm. But that fundamental realizing your North Star about what you care about, and also your position of power, whether it's in government or in corporation or in philanthropy, and also that real what that means in terms of your responsibility to listen and to engage others and share that.
Thank you, Carol. Rich.
Thanks. Well, I am new to philanthropy. I'm going to say that for as many years as I can get away with it. But I still feel very new to philanthropy. And there are a couple things that have struck me about philanthropy. One is I've never been in a sector with less accountability. It kind of blew me away coming in government. We had to justify our budget every year to Congress. At ABC, minute by minute, they were looking at the ratings. And now in philanthropy, we're accountable to our board, we're accountable to ourselves. But in terms of a formal system of accountability, it's really left to each philanthropy on its own to say, how are we going to hold ourselves accountable? Who are we going to be accountable to? And there have been a number of books written recently that raise these questions. And it's really important for us to address as an institution to say, how do we bring accountability in? How do we bring other people in to help in the decision making? So that's one observation. The other is that I think there's a real opportunity for philanthropy to use its voice and elevate the voices of its grantees to help address the issues that we're all working on. And it's one of the things coming from ABC that I saw in philanthropy as missing. The voice of philanthropy, the voice of grantees, could be having much more of a role to play in the conversation going on around health in America. And I'm looking forward to thinking about how do we do that at a time when evidence and fact are being so challenged. Philanthropy that, it's one of the things that Aspen tries to do, and it's convening, is be a nonpartisan place for people to come together. Philanthropy through our power of convening. It's been something throughout the history of the Robert Johnson Foundation. We viewed convening people across the political spectrum as an important thing that we can do. And I think there's a lot more we can do in that area.
Can I tag on 10 seconds?
Absolutely, very powerful.
So one of the things I like, I won't get it exactly right, but Larry Kramer at Hewlett always says, so yeah, we are the most unaccountable sector of the 3-4 sectors, but that gives us special responsibility not to waste that opportunity, which means speaking out, taking risks. And one of the things that I've always loved the phrase about philanthropy is to think of it or aspire to have it be the passing gear of society, that you can actually be stuck somewhere and actually have a chance to support people and leaders to figure out the new way around it. But yes, it's a great asset of philanthropy, but we better not waste it.
Yeah, very powerful. Let's open it up for if people have a question, if you would introduce yourself and have a short question would be great. And someone will come with the mic. We'll go there and then up front and back.
My name is Kay Henson. I live in Sarasota, Florida, and my husband and I fund programs in poverty elementary schools, but I also volunteer in one. And I was in the 3rd grade classroom the other day, and at least half of the children are on the road to obesity. I also have lunch with the children. None of us in this room would eat what is being offered at the school. And I would challenge you to please come to Sarasota and work with us in our school system. I don't think we're unique, but these children, one of the 9 years old in 3rd grade weighs 220 pounds. And the school is, I'm sorry, I'm more than 2 minutes. The school is talking to the counselors, but when you talk to the families, they can only go so far. So I think it's up to us to offer healthier choices in our schools and work with the families.
Thanks, Mary Kay. Responses?
Yeah, I mean, obesity is one of the areas that the Robert Johnson Foundation has put a lot of effort into. $1 billion is the commitment we made to obesity. I think as we look at how to address obesity in America, there are definitely no easy answers. I think all of the factors that go to promote physical, social, emotional well-being, health and well-being in children are the right approach to obesity as well. There's a paradox that if you look at obesity and poverty, they go hand in hand, and there's a connection between not having a living wage and spending your income on calorie-dense food that is connected to obesity. So, it's not about telling somebody, your kid really should eat some more vegetables and needs to go out and play. You have to change the whole system in the environment so that parents can provide for their kids what they know that their kids need. And it's, the school lunch program, yes, it's really important that we make sure that the school lunch program is providing healthier foods. But we can't stop at the school lunch program. It's a much bigger issue than that. Thank you.
Thank you, Rich.
That's right.
Okay. Let's do Joe.
Yeah, Rich, you wear multiple hats under your pediatrics hat.
And you are. He hasn't met you yet.
I'm sorry, Joe Jones, Center for Urban Families in Baltimore.
Hi.
I'm not sure how long you've been here, but a part of the theme that we've been talking about in the context of 2Gen has been on the inclusion of dads. And in your role as a pediatrician, also in your role in philanthropy, how do you think about being more inclusive of dads with respect to health equity, and how might that influence the priorities of the foundation relative to your orientation?
Yeah. I see a lot of dads in clinic, and I love that. I think we have to do something around the narrative around dads, because I think that dads are critically important, and the majority of dads are really engaged with their kids. And the narrative that dads, particularly dads of color, aren't there for their kids, I think the data don't support that, and we need to work to change that.
Marcia Edwards, the Martha O'Brien Center in Nashville, Tennessee. Dr. Besser. We are reforming a public housing community, and we're looking at all the areas that are impacting health and well-being. And everything from being a food desert to bringing in a major grocery store to new schools, new housing, everything, and no one's being displaced. So one of the things that I would like to understand from Robert Wood Johnson is really like how you define health, because we went through a human-centered design process with residents, and they defined health much broader than what we were anticipating. So from the foundation's perspective, how are you looking at health in terms of education, open space, clinics, all the above, not just access, but the other things that make people live a healthy life?
Thanks, Marcia.
I like the World Health Organization definition of health as being a state of physical, social, and emotional well-being, and not just the absence of disease. I'm new to it, but I'm loving the literature around well-being and how you define well-being, and what people think about they want in their lives, to have purpose and meaning, social connection. Those are all really important parts of well-being, and that's part of health. What it takes to allow people to experience that is what a lot of our work is around. I've almost 2 years ago I visited the East Lake area in Atlanta, and the work that Purpose-Built Communities is doing there, that is really stepping up around all of these factors around jobs that pay a living wage, and good schools, and access to healthy food, and places to play. And I was talking to the woman who was the director of that, and she said, for the first 10 years, we refused to admit that this had anything to do with health. And then we looked at the data and saw that blood pressures were down, rates of diabetes were down, health was up, and it was health. These preschoolers outside playing, and the woman showing us around said, "Well, what do you notice?" I said, "Well, it's a diverse group of kids and they're having fun." She said, "Well, what else?" And I said, I don't know. She said, "Are any of them overweight?" I was like, "No." I said, "Well, what's your anti-obesity program?" She said, "We don't have one." It's creating the conditions that allow people to lead a healthy life. And that's exciting to think about. How do you provide that as the norm for everybody in America?
Yeah. So I will comment on that one, because I think one of the good pieces of news over the last 30, 40 years, but really over the last 10, is our power to look at disaggregated data and to really go in using big data, going into community and really seeing where it maps out by zip code about housing, about where are the babies born, where is their licensed family child care, where are their informal networks. We do a lot of work on climate change. Yeah. It is an existential problem for our planet. And one of the really exciting things is the power in communities to be able to monitor health quality and air quality and other determinants of their real health and see how these things cluster and come together. So it's both disaggregating data and looking specifically, but then it better empower us to really put policies in place that recognize those differences.
Absolutely, Carol. Let's go, Shannon, did you have your, Shannon Christian?
Shannon Christian, Office of Child Care. I was just wondering if you have suggestions and strategies for how we might deal with Congress in approaching them about this more holistic and comprehensive strategies for dealing with children and families when they're so set up to have so many different rules, programs, each in a different committee, as many as possible, because then they can put their name on it. And, you know, it's like they're set up to break things into pieces, and we're trying so hard to put things back. And I just wondered if you've had an impact on changing that thinking at all.
And just to round out your introduction of yourself, Shannon Christian is the director of the Office of Child Care for the Department of Administration and Children and Families at the Health and Human Services Department. So just wanted to make sure.
Yeah.
little public-private Congress question.
I think there really, over the span of children's advocates' work in this area, there are openings to really work at the federal level, and then there are openings to work very much at a state and local level. We're in that state and local level opening right now, and we can see when states or communities come together and make their voices heard, it does have an impact here. And that so much needs to happen in terms of organizing at that level. We do the Finish Line States. We do a number of state networks of supporting multi-issue-based child advocacy organizations at a community level. We're also supporting Cecile Richards right now in a new project she has with iGenPoo on Women's Project to get women engaged around the issues that matter to them, not silo issues, but issues that matter to them at a local level. And I think we really we'll find that there's much more common ground. And wasn't it gratifying to hear how much healthcare access was figured in the 2018 midterms, and that it became an issue? And we just need to keep raising those voices, because the fact is that we do care across issues. We care about parents and families, the adults in children's lives, the family unit. And if we can just organize ourselves now at a local level, I think we'll see some real change.
Thank you.
Yeah, it's a great question. One of the big things we are focused on is shifting mindsets and trying to shift mindsets around what the drivers are of health. And part of that is when we start talking about things and people say, well, why is the Robert Wood Johnson Foundation, a health foundation, talking about housing and a living wage and transportation and these issues? What's that have to do with health? And it begs that question. And through who we pull together, the type of convenings we do, that can shine some light as well. But it is a real challenge to when you think about at the federal level how things are funded and how things are siloed. As I meet with people at HHS, they say, well, you know, we have control over these levers. Some of those other things, well, you know, if you look at the school lunch program, that's in ag. If you look at housing, that's over in housing. And so it's those departments don't always see themselves, see the clear connection to health that's real. And I agree that at the state and local level, a lot of action can take place. We're doing a lot in policy, and we're going to be doing even more.
That's great. We are coming towards closure in terms of reception time, so I'm going to do a little bit of moderator privilege and take a few more quick questions. Don't worry, I'm seeing. I'll have some friends, and I will not have other friends.
We're staying for the reception too, right? Sorry.
Okay.
I'm staying. No.
Thanks. I'm running for a train.
But take a couple, just a quick introduction of yourself and just a short question, and we will start with you, Maria. But we'll go through and take a couple, and then and then Rich and Carol will answer a part of a question or a thought. They won't be able to do it all, so just in defense of them. And then I also want to ask them just to have a chance to take a moment and share their kind of final thoughts for all of us as we think about the day we've had together, what the work we're going to wake up and do tomorrow, and how we're going forward. So we'll start with Maria, but you model, introduction, and short question.
Okay.
Fabulous.
Maria Gomez, President and CEO of Mary Center. And my question, I guess, is I work here in DC, and my question is, how do we leverage, and I love the idea that you work at a federally qualified health center, how do you leverage that work? Because those centers are funded by the federal government, and there's such great opportunities. Families come in there, and we see the impact of partnering with different agencies and the effects on health outcomes. And so I would love to hear from you what do you think, how we can bring those
Great. And you forgot to mention you're a national advisor to the Family Prosperity Innovation Community that we're doing with Robert Wood Johnson. That's okay.
Thank you. No,
Totally kidding.
thank you.
I love
you
you,
said
Maria.
short.
All right. A question over here from this group? Oh gosh. All right. Then we are going to do Jessica quick, Josh, and then back there. But you guys are going to be super quick. Thanks, Eddie. If you can get Josh.
Doctor, I'm Jessica Seinfeld, the annoying student asking too many questions today, but I am a student here. So mental health and your foundation, Untreated Trauma, what are you doing? Because we've talked so much about physical health in what you guys are doing. Are you taking a special look at untreated trauma or mental health?
Great question. Okay, back to Josh. Thank you. So far, we've got leveraging mental health, trauma.
I'm Joshua Sparrow. I'm director of the Brazelton Touchpoint Center at Boston Children's Hospital, Harvard Medical School. And this is a question for both of you, but Dr. Besser, you talked about mindset shifts, and I wondered whether or not you see a role in philanthropy for the mindset shift that I think connects what we've been listening to all day, which is when you talk about a culture of health and conditions and context for health, you don't really know what is inside of that without listening to parents and listening to communities. But then you have to act, and you have to act with, not for. So I think that involves a mindset shift as well, and I'm wondering whether you see a role for philanthropy in bringing about that mindset shift.
Thank you. And then one more back there. Thank you. Thanks, David.
Hi, Lauren Kennedy, a co-founder of Neighborhood Villages, and sorry, I'm on crutches here, so I'm gonna hold on to the wall. My question is, I think we heard a lot today about interest in going to communities and listening and hearing sort of community-based and community-generated solutions. And I'm curious how you sort of navigate that with how a philanthropic institution like yours typically does due diligence around how it would make an investment in a program like that. And an example I'll give is childcare, one that is very resource intensive, right? So it's a big risk, so to speak. How would you navigate a community saying, we need more childcare seats online, we need them now, and we need them executed in this way, but we can't point to proof of concept because it doesn't exist yet. So that's just sort of a open-ended question of how philanthropy thinks about community-based solutions that are tied to evidence but don't necessarily have proof of concept to point to yet.
Excellent. So we have a few minutes for our esteemed philanthropic leaders to connect on leveraging and specifically federal health qualified community centers, thinking about mind chips and connecting with parents, thinking about mental health and trauma in children, and then also really kind of robust community need now and how do we go. So as you think about which themes of those you might want to address as, along with kind of your parting words of wisdom and also to inspire us all to keep the work going, I will start with...
He's leaving first.
Rich.
Oh, God. Thank you. That's very kind. Well, thank you for those questions, and I can't really do them justice in this short time. The question about mental health, I don't think you can really separate or should separate mental health out from overall health. That's where what I like about the WHO definition. It's really physical, social, emotional, health, and mental health is part of that. We've done work in that area over our history. We do a lot of work and have around access to care and our belief that everyone in America should have access to high quality, comprehensive, affordable health care, and that includes mental health services. When you think about the untreated traumas, I know there was a talk earlier about ACEs and the impact that ACEs can have on a child's future if they're not treated, if the experiences aren't buffered. We really think of a lot of our work going upstream towards primary prevention. How do you prevent ACEs in the first place? One of the concerns I have is that so much of the conversation around ACEs is what I would call secondary prevention. When you've got kids who already have had these adverse childhood experiences, how do you ensure that they have the best outcome possible? I want us to, as a nation, say it's unacceptable that kids are having these experiences. How do we promote the positive experiences for kids growing up? So that's kind of our into that area. The issue of mindset shift. One of the things that we focus on is how do we stop the othering that's taking place in America? And it's a phrase, I think Ai-jen Poo is the first person I heard really talk about that. This idea that there's the us and there's the other, and the other are less worthy. How do we change that narrative and that conversation? And the issue in terms of going out and listening is, it's a really big challenge for philanthropy, is of how do you seed power, how do you really listen and let communities take charge. One of our big funding areas is around leadership, and it's been throughout our history. And our change leaders, I don't know if there's any change leaders in the room, but I went to one of our, you're all change leaders, but leaders who are in our change leadership program. I went to a meeting of 450 of our change leaders last month in January, and these are people at the community level who are identifying the problems that they see and the approaches to solving them. And it's the second time I've been to one of those conferences, and I leave incredibly inspired and optimistic for the future of our nation. And the last comment I'll make is, we're talking a lot about health equity, and we know we have a lot to learn about this. We are not experts in this area, but I encourage you all to not be afraid to join the conversation and to talk about things that are really hard to talk about. We're trying to do that and stimulate others to do the same thing.
Thank you. Powerful.
That's great. Good. I think I'll pick up on the questions around philanthropy and is there actually a change in mindset? And the distinction I made at the beginning, but not just listen well or deeper, but listen with a willingness to change and to demonstrate that so people actually believe that you mean it. And it means also how you create your strategies. So like the work we're doing in community in Fresno and a couple of other communities, but really in many others across issue areas, really is about constant feedback loops and changing, but demonstrating that listening with a willingness to change. One of our great initiatives that we're proud of is in the community of Salinas, and we have a bunch on our website about that, where we went in and really the youth of Salinas crafted the initiative. And Foundation's been working there for a long time, and we're just seeing so much more. And I think even though we can't do that in all the communities we work in, that mind shift overall is happening at Foundations. And also that it means you change your application processes. It means you make it more user-friendly in different languages, and you don't have the same sort of requirements in terms of what all the aspects of the proposal, and you have people available in community to help with writing them. If you really mean it, you listen with a willingness to change. But I think it is happening, and that doesn't mean you aren't a strategic philanthropist. There are ways to be strategic and have real outcomes and goals, which gets me to a second piece of just a theme that I've already heard today is about accountability, and we talked about who are we accountable to? And it begins with you. But I do think this moment in time is a chance to underscore accountability. I was here and got the newest publication of in the power of data for that. The newest publication of 0 to 3, thank you for that. They're passing it out here, and they've always been good on data and holding people accountable. Also, Packard just funded Impact for Kids. Is it kidsimpact.org? Yeah, with Wendy Lazarus and Lori Lipper, who have been child advocates for 40 years, but really taking that overview of all the different mechanisms that have been developed around holding policymakers accountable. And I think we all need to be developing those tools at a local level and as well as at a national level. And was glad to hear Lynn Johnson talk about that herself today. But I'll just end with saying that there's so many people in this room that really have been at this for 30 or 40 years. And I think we should appreciate that there have been very significant good policy changes in the country, that more kids do have access to health insurance, that there is more salience to the issue of the quality of early ed and childcare, more access to preschool, and we could go on. But that it really is a time not to rest on that and to realize that it is a journey that will continue, and we now have to be really effective at holding people accountable for not losing that progress. The final thing I'll say is I'm 66. My dad's 95. I'm stepping down from this job at the end of the year, but as many of us in this room anticipate that we'll have 10, 20, 30 years more life to devote to children and children's advocacy, and to try to think about that in new ways. But I wanted to mention one other book that the Aspen Institute is going to be highlighting this at the Ideas Festival, and it's by one of our grantees named Mark Friedman. And the book is How to Live Forever, that the real fountain of youth is the fountain with youth. And that basically there are so many ways for us all who have cared about this for so long to keep plugging in, and hearing about the grandparents taking care of kids and a two-generation approach. Well, there's such power in a 3-generation approach, or even a 4-generation approach. And it isn't just across biological lines. I had the privilege to have lunch with Alison Gopnik, the child psychologist, and she has a great line in her book about, do you love because you care, or do you care because you love? And we think it's you love because you care, that caregiving, we've heard this with brain science, caregiving creates that bond. So I'm going to be looking for ways in which, in my next decades, can continue that journey, but I think it's something to think about a cross-generation approach that involves older people in what's become a really segregated society.
Absolutely, absolutely. Well, first of all, Rich and Carol, I want to say thank you so much for being with us, not only today in this conversation, but really being with so many of us in this work. The Robert Wood Johnson Foundation and the David and Lucille Packard Foundation are really, deeply mission-driven, wonderful teams of people, wonderful gatherings of grantees that are true partners. And I think as we think about working across generations, as you call out, Carol, as we think about there's so much we're always building on, as we all stay really open to what we can still learn with together. That openness of mind and heart is so important, and also really staying connected with community and families at those front lines in ways that you both are doing in the essence of how you choose to live your lives, as well as how you're running your organizations and helping make sort of wise sort of partnership investments. And so I just have to say, on behalf of the Aspen Institute, Dan Porterfield and Elliot Gerson, you all partner with the Aspen Institute, whether it's Ideas Festival, Spotlight on Health, Work with Ascend, and many others. We're really grateful for the partnership, and I'm really grateful for also the partnerships you've made with us, with other organizations that you have connected us to. And so we will be moving to a reception. Carol, apparently you'll be getting a lot of opportunities and offers to come work with them. Rich will come on the tree. But really, on behalf of the Aspen Institute, Rich, Carol, thank you. And thank all of you.